What's up, y'all? This is Carolina Doc PT, and today we're going to be answering a question. Well, not really a question, but we're going to be addressing a statement that a patient made on another one of my videos. Yesterday, I believe it was. This other video, it's a knee replacement video, and it's a video on the reality of having a knee replacement. And this particular patient or particular viewer said that they are still having pain and stiffness out to 3 months. Um, After their surgery, they said that they're doing their physical therapy twice a week and they're exercising daily, and they're still having pain and stiffness. So I wanted to go over that because I think that is a I'm not gonna say it's a common complaint, but it's not an unusual complaint. And so that I think this deserves a little bit of talking about. Okay, so what I wanted to do is go over all the reasons that you may be having continuing pain and stiffness in your knee. Okay, this is after we're talking like about maybe 3 months or so out from having had your knee replacement. So let's go with an easy one. The first one is that you are not exercising and doing the exercises that your physical therapist has told you to do. So that is not apparently what this particular person is addressing, but that is one reason that you might would have pain and stiffness in your knee. Another reason you might be having some pain and stiffness there is that you are doing too much. Okay, so if you want to think about this in terms of breaking things down, and so if you are working on trying to strengthen your knee and you're constantly doing that, every time like weight training and activity, like the way that you get stronger is you're basically tearing the muscle apart with heavier task or heavier weight or higher intensity activities, and then when your muscle recovers, it will be stronger and it will take more effort to tear the muscle down again. And so that's the process. And then as your muscles get stronger, then they're pulling on your bone, and so then the bone actually gets stronger, and so bone grows, and so that's kind of the way that a person gets stronger. Well, within that process, as I said, you're breaking down, so that means you are creating inflammation in the area. So it could be after your knee replacement. There can be too much of a good thing where you are doing too much, or maybe you are working too hard. If you are, what I would recommend, if and this is what this particular person was mentioning, you may be exercising too much. You also even maybe you're exercising at about the right amount, but you may be working at too high of an intensity. You want to, if you're having the feedback of pain and stiffness, then what that would kind of automatically tell me is that, well, we need to pull back a little bit on activities that you're doing so that you are not creating inflammation. Because with inflammation, you're going to get increased swelling. Increased swelling, you're going to get increased inflammation of because you're having your body kind of attack that area to say, hey, this is an area that needs to heal because of the damage that's been done. And so it's going to increase the inflammation there. So you're maybe doing too much if you're still getting pain and stiffness out to 3 months. Um, Depending on the type of additional symptoms, let's say, that you may be having with that, possibly there's an issue with the joint. I'm going to say that that is likely not the case. You always want to assume that the surgeon did their job and they did it well. And so the same goes for the part. I've had a few, like very small, very few patients where there has been a failure. And matter of fact, I think I can think of one, maybe two in the last probably 10 years. So it doesn't happen very much that there's a failure. So that is likely not what it is. Um, it may be that you advanced too quickly from your assistive devices. I did a previous video on this where when patients advance too quickly and too early, going from a walker to a cane and then a cane to nothing at all, that they may not be training the knee during exercises, but just activity because you advance too quickly early on. Um, you have strained everything, and it's in need of rest. Continuing because just walking without the assistance of an assistive device can create that same pain and stiffness. Um, the You may be standing on it too much. That's another reason that you might would have pain and stiffness is maybe you have returned to working, and you're just on it too much. Again, that is more than likely an overuse type of a deal. Um, that again goes to that inflammation. Um, you could be doing too little. Um, which, well, I mentioned that before, sort of, but it's just that I specifically said was doing not doing the exercises that your PT gave you. But this, I'm gonna say, is more. Let's say you're sitting too much. That let's Let me change that. We'll say you've been sitting too much, and because you're sitting too much, then the knee is gonna stiffen up on you, um, and it's gonna that when it stiffens up, it's gonna be painful. So that's another reason that you might be having pain and stiffness. um, Let me also put this out there. It could just be you, okay? Everybody heals at different rates. I mean, in general, with these, you're in that 6 to 8 week range, which should be, starting to feel kind of significantly better. You still would be having some dysfunctions and some pains going on, but um, you're still, for the most part, you're starting to see the light of day at that point. So now, if you're at 3 months out, and you're still having pain and stiffness, you may just to heal slower. This particular patient or person didn't comment on how old they are. It does take longer. The older you are, the more longer it's going to take for you to heal. So the younger you are, if you get this type of surgery, then you may heal a little quicker, and it might be a little more easier. It might be can't talk, it might be easier for you to heal. So that's actually kind of interesting thought, even because I know one things we've always even sold in our clinic was the idea of like, well, if you do physical therapy, you can delay actually having a knee replacement surgery, say, or even a hip replacement, what have you. But the longer you wait, then the longer it also may take you to heal from that surgery. There are definitely benefits to having surgeries done at a younger age. Just your body just can heal quicker. Um, Also, another reason you might be having pain and stiffness, if you are an individual who, led more of a sedentary lifestyle, if you're not used to um, being active, then that also might lead you to taking a little bit longer just to go through the whole process. It could be that you're not able to push yourself quite as hard, and working on that range of motion. Maybe it's been kind of slow and steady, but that would hold you back probably a little bit compared to someone who has worked out really hard most of their life and are used to pushing themselves and pushing into pain and things when they work out. So that's another reason that you might be having some pain and stiffness there. So the point of all this, and the reason that I wanted to go through all these different reasons as to why you may be still having pain and stiffness in a knee joint after, like, about 3 months after a knee replacement, is just to kind of emphasize that this th- having a knee replacement, having any sort of surgery, is going to be, even though we talk about, in general, these are tolerated really well, or in general, these particular types of surgeries can be really painful, etc. Everybody's going to experience this at a different level. And depending on your health history, I mean, goodness, we didn't even talk about like, well, maybe, a person's a diabetic, and so maybe their blood flow is not as good. And so then that could be causing, some difficulties. Not even talking about just medications in general. Maybe the person's having kidney issues. And so therefore they already have increased swelling in their legs. And so when you have increased swelling and then you're also adding in a knee replacement, then that also can lead to extra swelling and a little bit more difficulty in um, going through this process of healing and recovery from having a knee replacement. So it it's doesn't being having pain and stiffness at a 3 month at a goodness gracious, I cannot talk this afternoon. Having pain and stiffness at a 3 month mark after having had a knee replacement is not necessarily indicative of any significant serious problem. Okay. I would recommend that if this is you and you're experiencing this, that one, you talk to your physical therapist and do a real detailed, honest account of what you've been doing activity wise on a day to day basis for the last few weeks. I think you are likely going to find that you are overworking. And you are likely, especially if you are working daily and you're also doing physical therapy and all this, and you're pushing yourself hard, um, you may be just working too hard. And so a factor in recovering from any type of surgery is rest. So, I would suggest that that is probably the number one culprit. As I mentioned, there can be many others here. I would say the most common reason that you might would have pain and stiffness at about 3 months is you probably are working too hard, and so you're probably overworking it, and you're not giving your body enough time to actually heal. Um, Also, let me come back and also mention this. Your surgeon has probably already told you, and your physical therapist has also probably already told you, you will be recovering from these knee surgeries out to a year. So expect that it's going to feel strange. It'll feel odd. You may have random pains here and there. If you step wrong or what have you. I mean, you have a brand new knee. And so your body is getting used to this new normal, so to speak. And so you're going to have some of that. But the farther and farther away you get from the surgery, most patients, I'm not going to say all because it is not all, but most patients will report that this is one of the best things they ever did and they would have done it sooner. And they'll report significantly improved function and little to no pain. Um, and, will generally wind up saying, wow, I should have done this earlier. So, uh, so don't be fearful about it. Talk to your physical therapist. If the physical therapist doesn't have any ideas, then I would talk to your surgeon. And as I say, there's a possibility there could be issues with the joint, but that's rare. That would really be my last thought. But make your physical therapist aware and be very honest with them in your assessment. And I think you're probably going to find that you've been just overactive with it. And because remember too, what you're doing in your day to day life. Like if you're exercising, you're doing your physical therapy. So and I'm saying those are two different things. So you're doing physical therapy, you're exercising on top of that, because that's what it seemed to sort of read like in this particular person's statement. And then you add that on top of, let's say, you're going to work, and I don't know what type of job the person has, but too much sitting, too much standing, that can cause irritation too. And so it's I not it's not a thing that you need to think, "Oh, wow, this, knee replacement was not successful," if you're having these complaints. It just means moderate your activities a little bit, make sure you're not overworking it, continue to work, and then let your body just continue to heal, making sure that you have rest. Um, yeah, and just let time continue to pass. That's one thing that uh, uh, patients oftentimes don't really appreciate, but sometimes you just need time. You just need time to pass, keep doing what you're doing, but do it within a tolerable range and let it heal, and you should be fine down the road. So I hope that has given you a little bit more insight as to why a person might would still be having some, some pain and stiffness at 3 months out. As I say, not necessarily indicative of anything. Could also just be the person's healing. So there are a lot of factors there, a lot of variables. But if you will continue working on it and just moderate things, I think you'll find a good outcome and that you'll have some success or have good success with it. If this video was beneficial, do like, subscribe, and share it out. We will catch y'all next time. All right, later.